I'll be there for 1 week. We'll talk.
Okay, I'll tell Dr. Rajesh.
Right. Please.
Please come. Yes,
Let us see. Yeah, program. But we'll meet them.
yes, 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 yes.
So now Avnish is there. I think you can
Hmm.
restart.
Yeah, just because something was, yeah, now I am logging in with my laptop.
Perfect. This is
Just,
fine.
just a minute. Yeah, yeah.
So I'll start again with your
I'll
introduction.
log from my number.
And I'm making official
Okay,
report
just a minute. Let
so
me
that
finish. Let me, let me.
Pause the recording. I'll start with the introduction. Hmm? So, good evening, ladies and gentlemen, in today's clinical meet. In today's clinical meet, we have with us Dr. Avnish Dave, MD Physiology and PGDCH. Dr. Dave is Professor of Physiology and Dean in a medical institute. He has been practicing hypnotherapy for various years in various psychosomatic conditions, and he has special interest in pediatric hypnosis and industrial psychology. And Dr. Dave is going to present, uh, I'll just read out the topic of the presentation today. He is going to present a case of psychogenic tremors diagnosed as Parkinson's and controlled by hypnosis. Over to you, sir.
So, thank you, Nidhi madam, and good evening all. And today's meeting, we have my colleague also, Medina Shankala, and she works with me. She is a counsel. And fortunately, in this case also, she was present for few sessions. So I welcome you, Meghna madam, as well, and all the other participants. Uh, More or less, today's presentation is going to be a story reading because I don't have a PowerPoint on that. But I will try to briefly narrate how step by step we went. And with all learned people around, I seek that you will guide me also. So, uh, this is a case of a 48-year-old male. I am audible, I suppose. Yeah.
Yes, sir.
So,
Yes.
yeah. So this is a case of a 48 years old male and with a chief complaint of resting tremors. Means whenever he is not working, his hands are still or legs are still. Slowly they would pick up a small movement which would keep on increasing over time. And whenever this hand or the limb comes into action, then the tremors are gone. So this is typically on a very first sight. It appears and it is very easy to believe and diagnose it as a Parkinson tremor. And that is what how the story also started. So 4 years back, the person was perfectly all right. And to start with, he had some event in his family of somebody passing away. And after which he was feeling little psychologically, mentally low. And that is where he started feeling tremors or the involuntary movement in his left lower limb, especially around the knee joint. And then they kept on increasing day by day. So when we took up the story, sorry, the history, then it was mentioned that uh, this subject's grandfather had this kind of problem, and this fellow, as a child, had seen it because he was very much fond and attached with his grandfather. And he used to, at a time, play with it, and he used to be always curious about what is this. this resting movement which his grandfather is having. And so he had that early childhood impression of what is Parkinson tremor. Now, it was never diagnosed even in the father also. Yeah, I mean the grandfather, and never treated also because might be they were staying in the village. But he narrated, the family narrated that the grandfather had this. And so many such neurological conditions are considered to be inherited. So they run in the families, that is what they are labeled as. And so this child also had a fear from the childhood that, I might become this thing. The grandfather, on history taking, we found that contracted this condition at his age of 72, whereas this person started getting it at age of 45. So this other part of the history was also gathered, and there was no such history of trauma or any injury or any such illness related with the central nervous system which could have caused the damage. Nor there was any history of exposure to any kind of consumption of chemicals or exposure to chemicals, because the person is a shop owner and a farmer otherwise. So there was no occupational exposure or accidental exposure to any such chemicals which might have unknowingly caused some neurotoxicity. Nor the resident was in the vicinity of any industry which would have been releasing. So, considering all the other factors before taking it up as a psychogenic, that is, in such neurological conditions, it becomes a big challenge that we have to see all the other perspectives, and the consultant or the physician might have missed something. But I feel that as a hypnotherapist, we should be little extra cautious that nobody should ultimately blame our science as we have been too enthusiastic to count it, and disregarding or not checking out properly or ruling out properly other conditions. So we checked all the rest of the things, and the patient had taken treatment from two neurologists, neurophysicians at different time. And so around 2.5 years back, the patient went to the first neurologist, and uh, that neurologist had undertaken all the necessary investigations, including the CT scans and MRI, and no significant correlation was established or proven at that time. So while going through the case papers, the old case papers, which I asked from them, all the case papers they had brought, and uh, I could find out that from the very first prescription which was written 2.5 years back by the first neurologist, he had mentioned a small question mark and then Parkinson. So it was a query Parkinsonism, because the features were appearing like that, but it was not correlating on the investigations. The CT scan and MRI were normal. So as you study the case, the past records, I continue to get more and more confidence that the even the neurologist has not given an established diagnosis, because there was no. Second was that usually this Parkinsonism arises because of lack of a neurotransmitter called as dopamine in a particular circuit, which we call as the some group of nuclei, the brains, the basal ganglia, which are connected with the planning and performance of the motor activities. So all the voluntary motor activities are planned and performed by this group of nuclei in the brain called as basal ganglia. And they have a peculiar particular circuit which gets activated in a very sequential manner. to execute our voluntary movements in a very planned and precise manner. So, whenever there is a lack of this dopamine neurotransmitter, it may lead to the lifting up of that control, and the person may start showing some neurological signals spitting or releasing out from the central nervous system and getting transmitted through the spinal cord into the peripheral nerves and the muscles performing this action. So it is a spilling over of the signals under the lack of the neurotransmitter. So this is a little, I'm not going into the technical details, but so the treatment usually started by the neurophysician is a levodopa. The dopamine is the neurotransmitter and L-dopa is the synthetic version of that neurotransmitter. And that is supposed to control those tremors because it arises from the deficit of this dopamine. So if it would have been ideally a Parkinson resulting from the lack of neurotransmitter, this dopamine would have sufficed to control those tremors. It could only do it partially. Now, while going through the history, the second influence was why the patient was with the treatment of the first neurologist. He talked about this problem with his one of very close friend, whose mother also has the Parkinsonism. And so this friend was quite convincing and they were quite close friends. So he told that, this is a very, very, untreatable disease and there is no cure for it. And my mother has been suffering from last 15 years. And she has this condition kept on increasing from one part of the body, and now all the four limbs are involved. And so this fellow, being so emotionally attached to this friend of him, took up was under so much of influence. He met his mother also and got into so much influence that his tremor, this resting tremor, then started happening in the right upper limb. So his right hand started showing that shaking movement. So that is how this fellow picked up a symptom mimicry. His symptoms started mimicking, though he was fully under the treatment of the medicine. But on the contrary, he started getting worsened. The neurologist tried with all the other possible things, but it was not coming in control. So finally, when such kind of people, they keep on questioning, surgeons have to show some future advancement in that area. And he said that some surgical advancement is under research. And maybe after another 5-10 years, it may become established. And so I think that may help you. So they go for some kind of neurological resection. And so the surgeon said that this kind of research is going on in the field of neurosurgery. And maybe that can help you. Till then you continue with this treatment. So meanwhile, he got little terrified with that also, that it will require surgery and all that. So further disappointed, he went to another neurosurgeon, neurophysician. And the other neurophysician also started with the same or similar drugs. And then sometimes, the earlier doctor had written the levodopa as a treatment. This fellow presumed that it would have been a established Parkinson. So he boldly wrote Parkinson, but he did not go for any investigation. It was purely on the presumption of the previous treatment papers. So he started treating him again for the same. And there was sometimes relief and sometimes it was not. So the story continued like that. And meanwhile, the patient also consulted some Ayurvedic practitioners and they also made their own claims. Somehow this was not getting any kind of cure. So finally, the patient was referred to me, and we took up the detailed history taking, and then we started explaining at the conscious level before going to the subconscious. So at the conscious level, we started talking to him that whatever the symptoms of Parkinsonism are there, you don't fit into them all the way. At this point of time, the care is to be taken that to such patients, you don't describe any other symptom. So he was very curious, what are the other symptoms? I said, you need not know it, but your symptoms don't fit into a pure Parkinson disease. Because whenever you discuss the symptom with them, they may start mimicking that also. So they may have an addition. So they may start playing the new instruments in the orchestra. So we don't disclose them. And because he had a tendency to mimicry the symptoms or whatever information is there, so he started showing a little stiffness also, and then was fond of little Googling also. So we stopped that you may not go to research on your own till you are with our therapy, and not also to go to any other consultant, because sometimes he was already consulting one Ayurvedic practitioner. I said that we don't have any problem if you consume Ayurvedic medicines, but don't discuss your case with anyone, because sometimes not intentionally, but they may introduce some negative comment, and that may actually harm whatever positivity we have created or whatever mindset we have created. That might get disrupted, or that might get damaged very fast by a single comment of somebody. So I told that if you are taking, you will not discuss these things. You will keep this as a secret. Then we started, and I explained him about that how he has got programmed from the childhood, and how he is very sensitized to this thing, and he has a belief that he is also likely to get this. And that is what is right now harassing you, is the problem. And your symptoms don't fit into the classical Parkinsonism, and so you don't have it. Even your earlier physician has not put a bold diagnosis. So that was explained to him, but we know that subconscious programs don't respond so fast, because it has been there since many of decades of his life. So we started giving him with the relaxation, and while we were talking to him, the movements intermittently stopped. So whenever his mind was involved in some kind of communication or learning, knowing some new concept, his movements used to stop. And then I used to make him realize also that your hand is lying still since last 20 minutes we have been discussing. I used to make him put his both the hands on the table, and then I used to start talking to him. So the relatives also would acknowledge that yes, your hand is lying still. And I introduced this word to the relatives, that you will not comment that you are not having tremors or your hands are not moving. Instead, try to reinforce it by saying that your hands were lying still. That is what we have learned in the principle of positivity. So I taught it to the relatives that whenever you are talking with him, always mention and appreciate his keeping the hands still or stable, instead of discussing that he is having a movement or tremors. So avoid the word which we don't want. So that way, the education was given to the relatives, and I used to keep on reinforcing 3 to 4 times during a session that you were able to maintain your hand still for last 15 minutes, for last 20 minutes. So you have that control with you. Then we gave the breathing session, before that, I also gave him a short session for achieving control whenever he is in a wakeful state, whenever he is in his shop because he is a shopkeeper. So I told that whenever you are free in the shop, he used to get these tremors or the movements only when he was sitting free. Whenever the mind is idle, he would start getting this movement. So I told him that whenever you get free, you will just close your eyes, focus on your breath, and give suggestion to yourself that while I am breathing in, my hands are learning to remain still. And while I am breathing out, my body is feeling really relaxed, and it is becoming flexible. So that he also mimicked the symptom of rigidity. He read Google and then he found that rigidity is also one of the feature. Other things he could not understand, they were medical terms. But these people have tendency to copy whatever they know about it because they want to forcibly fit themselves into that coffin of the disease. So he was picking up symptoms by symptoms whenever he used to research. So we gave this that whenever you are sitting idle, you will start practicing this breathing uh, tricks that you are while breathing in, you will give this suggestion. While breathing out, you are becoming more flexible and relaxed. So that is what I gave first. And then he continued to listen to the sessions. The big thing was that these tremors were not aggravated by emotions, which usually is the feature of Parkinsonism. And the person used to get a good sleep. While he was in sleep, it used to also remain silent, which is also against the feature of Parkinsonism because most of the time Parkinson people have a disturbed sleep because of the this uncontrolled involuntary movements. So that those things were not there. Another thing was whenever he was doing a voluntary activity, there used to be no such tremor. Otherwise, they have a problem in generating a balance and they are not confident and that at times they may fall. So he used to rather drive the car also very precisely and perfectly. So there was no such problem. He never made an accident, never had a problem while walking. So whenever in action, it was a very precise action he was having. So with all these things, we told him this and he continued to practice. In session one, we taught this breathing awareness. This breathing technique was given and he used to follow it well. And on the second session follow-up, he was quite better. But intermittently, those things were coming in between whenever he used to be free. At that time, we discovered that there was a component where he wanted to retain the symptom because there was some partial benefit. Then I gave him the physiological explanation of how the basal ganglia circuit is present and how it is interacting and where the symptoms which he is showing are not fitting into the uh, real Parkinson, and so he should continue to think again and again that he is not having problem, but he is actually all right. I told him that you don't have a disease, you are actually all right. So start talking to you this more and more that I will get all right. That is what he was asking. I said, you are already all right. You are already perfect. There is nothing in it. And nobody, no learned person nor the consultants have been able to prove that you have any problem. So that means the things are not there in you. And a PMR session was then given and he was listening to that. While the sessions were there, he was fully cooperative and the body used to be perfectly still. Control even while deeply involved or his hands used to remain stable. On a session 3, patient actually started feeling better. But as I said, the family said that, he has some secondary motive of people, and he expressed that he wanted to avoid as well as
अवनीश
going out to work.
अवनीश अवनीश
Financially, he was very strong because.
अवनीश आवाज
Hello.
थोड़ी कट रही है, तो यू मे
In
बी
between
लिटिल
there was
क्लोजर.
a,
हाँ, प्लीज.
yeah, little unstable connection was there, I think. Can you hear me? Hello. Am I audible?
Yes, sir, you are audible now.
Okay. So there was a message that the connection is little unstable. So yeah. So I think I was clear up to session 3. Hello.
Sir, probably you can try putting off the camera, the video, and
Yeah,
then
I'll
restart. Yeah,
put off the camera. Yeah, that is a better. Yeah,
because
no,
it
I
takes a lot
think
of bandwidth.
a such thing is to show.
Yes, now we are.
It takes a lot of bandwidth. Now I'm audible, no?
Yes, sir, yes,
Yeah.
it's better.
Okay. So I talked up to session 3. Session 3, I could discover that he has some purpose to retain his symptoms. But we went with imagination, and he used to believe in, he is a believer of Lord Swaminarayan. So he narrated that, he visits the temple very often. And so I said that whenever you visit and you see the statue of Lord Swaminarayan, then you focus on it and you start thinking that your body is also becoming as stable as that of the statue. Whenever you see that stillness in yourself, you start thinking that the divine is already present in you, and the Lord has already blessed you and given you that control uh, of regulating your own body activities at your own will. So I created a kind of divine connect, and that is what we went up to. And after that, the patient had some marriage functions or something. So after that, since last 1 month, I think they are busy with something, and so I am expecting the next follow-up. But the message which has come is that he is better. At times, again, it comes, but the patient has improved a lot as compared to previous. So that is what we could achieve with using not very complex but very simple steps of hypnosis. We have not been able to go to any kind of deep programming, but including this, his own beliefs about his faith on Lord Swaminarayan. We would introduce that, and he goes daily to the temple. So I said that, every day you are going, you are getting these divine blessings. And whenever you are getting it, you are getting the control over your body, just like you become the statue of God, Swaminarayan. So that is what it is about.
Okay. Very nice. Good case. Uh, Anybody, any comment or query? Comments and queries are welcome.
Comment, queries, questions.
Very nice presentation. I just have one query. How was the sleep of that total person?
Perfect.
Sleep,
He was
because
sleeping
most of
very
the
well.
cytonic tremors, they are good, they are obstructed in sleep.
Yeah. This person had a perfect sleep because of there was no involuntary movement during the sleep. So that is what was going contrary to the typical features of Parkinsonism, where the person has a disturbed sleep, and because the involuntary movement rather increasing more during the sleep or the period of inactivity. But he used to go even in our clinical sessions also. The moment we used to start taking up the relaxation, he immediately within few seconds his hand and leg used to remain go very still and relax very fast.
There is a very good insight during the whole case that he has observed the Parkinson patient in the family. So this is learned behavior from the family. And one thing which is very surprising that is there any cause which is precipitating this observation? Because many times these are intentional tremors. When person become restless, the that release occurs with the tremors like this here. So is it possible to go in
Anxiety,
a deeper realm
anxiety,
so that we can explore that realm where it started, when you first noticed this like this here? It went
yeah,
with the age
yeah.
regression or something like this here, and then relating this story like this here.
So I mentioned that one of his relative passed away during COVID, and that was an intense anxiety. And COVID was a phase of intense anxiety for everyone. Every human worldwide was anxious. So there was an initial anxiety, and anxiety usually induces tremors. The commonest cause of psychogenic tremors is we think is the anxiety and sympathetic overactivity. So intense stress, intense acute stress and intense anxiety is common to start the psychogenic tremors. And he already had that programming in his mind. So then he started showing that pattern of resting tremor. So he had a modified type of anxiety where he started showing only resting tremors.
And one last question: how to differentiate between intentional tremors and psychogenic tremors?
So intentional, usually they arise because of uh, uh, the problems in the cerebellum or the small brain as it is called. So whenever there is some cerebellar dysfunction, the person whenever is doing some voluntary activity at that time, the person may show tremors. Means not able to exactly do the voluntary activity in desired direction and timing. So that is what we call as the intention tremor. Intention is whenever I initiate any activity, voluntary activity, then the part of the limb will show tremors.
One more.
And the resting tremor is whenever the person is not doing any activity.
Yes.
Yes,
So
I wanted to say something.
Sanjay, there is a confusion in many people that intentional tremor, that term do not mean the person is intentionally creating tremor. That term indicates what Avnish explained, cerebellar disorder, whenever the person will have an intention of carrying out some action. Suppose I want to put off my spectacles. So before I start the movement, there is an intention that I want to put off my spectacles. So that intention will create the tremor, and as my hand will approach the spectacle, there will be more and more tremor. So that is why it is known as intention tremor. It doesn't mean that the tremor is created intentionally by the person. That intention tremor is a very misleading kind of term. Therefore, many students used to ask this. It is not intentionally created tremor. It is when the intention of some movement is there in the mind, the tremor begins. And it is due to cerebellar disorder. While Parkinson tremor is just opposite. When the person is carrying out movement, no tremor, and at rest there are tremor. That is Parkinson. Okay, now Avnish, I appreciate it was a really good case, psychogenic thing. I remembered while you started presenting my first case in hypnotherapy clinic. You know, we started in our hospital hypnotherapy
Yes,
clinic in 1985,
SSG hospital.
SSC hospital. And the first case was referred to me was of paraplegia. Both the lower limbs were paralyzed for last 6 months.
Mm.
The person was villager and around 45 years age. And he had been to some hospitals in Ahmedabad, some neurosurgeon in Ahmedabad who suggested for surgery, spine surgery, and he was diagnosed as having that neurological paraplegia. But in SSC hospital, the neurologist did not find any sign indicating a neurological paralysis. Um, Only his legs stopped working. He was a wheelchair person. He could not move his legs. So neurologist referred the case to this hypnotherapy clinic. It was the beginning of hypnotherapy clinic. It was the first case, and then
Great, great.
I started like taking history, and from history, the relatives only came out with the fact that there was some quarrel between two brothers regarding their distribution of like after the death of father, distribution of
Property.
asset. Yeah, so that situation that fellow developed, and it continued. So he came by wheelchair to the clinic, and then it was my beginning also. You know, I started learning and practicing hypnotherapy during that time, 83, 84 only.
Correct.
So after induction of hypnosis, I found out that he was his religious beliefs help us. So he believed in Mataji, some Mataji. So I made him to visualize Mataji, who is touching his legs, and the legs are getting movement, and then he is able to raise the leg. So in the trance only he could raise left leg, right leg, and like that. And then termination, and then he could walk. He
Mm.
walked and went away. He came in a wheelchair and walked away, so walking.
Yeah,
So
instantly. So
that was
that's
a
a
very, very dramatic and miraculous outcome in
yeah,
that one first session only. Of course, I don't believe in such kind of
yeah,
one session treatment, but then at that time it happened. With, in neurological cases, many times um, the symptoms are misleading, and we find that there are psychological reasons. Several neurological cases, I have found that. So it's a really very good
yes, they definitely.
experience.
Yeah,
Prashanto, I would
that's
like
really,
you
really
to
fantastic example.
comment something, because
Sir, okay.
one thing which I found this your suggestion of becoming like the Swaminarayan that
That you,
yeah.
Murti of
So that I
Swaminarayan.
was bit concerned about it. He may really stop doing all movement and they may get paralyzed because his
Yeah,
mind
yeah.
is so sensitive.
No, yeah.
So anyway,
I was
right,
worried about the same.
right,
That they sometimes take up everything
yeah.
verbatim. But that's why
So
at the
it may
very
become
first I
like an
introduced
idol.
two things.
Right.
That
Thank you.
whenever you are awake, you are breathing in and you are getting stable. And when you breathe out,
Ah, thank
becoming
you.
flexible. So
Yes,
that
the
thing
flexibility.
way before I started this I introduced that.
Very good.
I was aware of this.
Good. Yeah, Prashanto, you were telling something. Please.
Yes, sir. Thank you, Dr. Dave, for a good presentation. For any such cases where the symptoms are mimicking the neurological symptoms, the diagnosis becomes very important in those cases. Because if you can diagnose, then the therapeutic strategy or the plan become easier. For this particular case, I'm having concern, like 3 of the issues that are coming into mind. One, what Dr. Dave was telling, the anxiety disorders, not otherwise specified, probably because he is not fulfilling the criteria for generalized anxiety disorders, not the panic disorders, not phobia, but other anxiety disorders are not otherwise specified. So this is a category of anxiety disorder. That is one possibility. Second possibility is dissociative disorder, dissociative motor disorders, particularly where there are fine tremor. So that becomes important because many of the dissociative motor disorders, they are being misidentified, misdiagnosed as neurological conditions, because even like dissociative pseudo-seizure or dissociative convulsion disorders, so they are the diagnostic parameter. Generally, neurologists follow the EEG as a parameter. And if there is EEG abnormality, they consider this is a true seizure disorder, true epilepsy. And if there is no EEG abnormality, they consider as a pseudo epilepsy or pseudo seizure. But if you see, the EEG is 50% valid. In 50% of the other seizure disorder cases, EEG might not be a valid protocol. So as we do not have many objective evidences to assess this symptom, there is a high possibility of the misdiagnosis if we particularly do not take the history. So, and third one, that's intentional approach. There we talk about factitious disorder. And at the age of 40, though Parkinsonism is not that common, but factitious disorders might be common. In factitious disorder, there are obvious secondary gain. So it might be related to, like, if there is a tremor, the person will not be able to sign the paper or sign the check. And so there can be some, the motive, the direct motive in the individual. So at times it becomes very difficult and we need to differentiate before intervening. So this is one approach. To me, it appeared it is more of a dissociative disorder, dissociative motor disorder for this particular case. And obviously there the role of relaxation and self-hypnosis and metaphor that can have significant contribution. So that is one part. The second part, what the Palan sir was pointing out, I was also thinking on the line. I can remember one of the cases that I wrote as a case study for International Journal of Hypnosis, Clinical Experimental Hypnosis. And that particular paper was rejected, though it was a very good case. It's a very rare case, but it was rejected because the kind of the metaphor that he used for that particular case. And the metaphor was particularly based on the religious belief of the client. So whenever, probably as a hypnotherapist, we have seen in Indian hypnotherapy, they use the religion context a lot. So there, the subjectivity, the subjective phenomena becomes important, and there is a less possibility of replicating the same. And obviously in the scientific, the population or the journal, they are less interested about those individualistic factors. Because faith healers are also doing the same thing. So as a scientific professionals or a health and mental health professionals, if you repeat the same process that faith healers are doing, those very idiosyncratic and individual approach, uh, so we probably need to rethink about it. So that is, I'm raising this particular issue so that there is a debate on this, what we can do, what we cannot do. And many a times we have seen that, for example, in Gujarat, the religious related example, idol related example, they work very good. But if you come to West Bengal, that doesn't work here. Rather, the people start
So,
questioning
yeah,
the model of hypnotherapy. So probably sometimes we need to have a discussion on this, what we can do, what we cannot do. So that's all for. Thank you.
Very, very good
yeah,
point for discussion. And I think
I agree.
we decide to discuss
Yeah,
on this issue in the
yeah,
next meeting. Next meeting, we will discuss
yeah,
how far we should be using it, or how shall we use it. If we use it, then what precaution we should take, and how to present those cases to the international audience, and all those things. Cultural and religious beliefs, they play a very big role in illness and wellness both. So I think it's a good topic of debate and discussion. So Nidhi, we do that
yeah,
for the next
Yes,
session.
sir. We'll definitely
Okay.
do that.
Yeah.
Sir,
yeah,
I just wanted to add one point to what Dr. Prasanta was discussing. So, a couple of days back, I happened to discuss one of my cases with Dr. Dayal Mirchandani. And because I was doing ego states therapy for a client, and in ego states therapy, there are certain sub models, one of which is called inner strength model, which Dr. Palan also uses in ego purification. And one is called internal family structures, wherein we consider that there could be secondary gains to any illnesses and which are represented by unconscious or semi-conscious ego parts of the same person. So it is disassociation, but not to a very high degree, a mild degree disassociation. And we can use or create one useful inner strength as an inner resource, which will be our ego part only, and personify it, just like we give some shape and color to the disease in ego state. Similarly, that inner strength can also be given a personification. And in religious, and if a person already have a religious belief, it becomes easy for them to see that personification as a deity with which they worship. So basically, it is the projection of the inner strength only, but in the way of personification. And there are certain papers written over this. I mean, people who do ego state therapy, even Dr. Gordon Emerson, he has also mentioned in few of his cases. I would be really very much interested in sharing those papers, and we can carry this discussion forward.
so you can discuss it next time. I
Please.
think
Sure.
you only take up the
Ah,
the leadership of presenting it, and
yeah.
such papers we start with, then we can have people who will
And
be reflecting on it. But one
Your
one
voice is very
one
low.
in
Yes,
my
sir.
case, I think the internet, or I need to.
anyway,
Yeah, now clear.
yes.
Yes, yes.
So as Nidhi madam said that these things are easy to practice and they come very handy to influence the symptom, and that's why I
We
remember from my classes of hypnosis, Dr.
Avnish,
Bhaskar Vyas sir used to use one sentence that use
just
the
a moment.
currency of the country.
One moment. We want to discuss it at length, so we don't
Yeah,
continue discussing that.
yeah,
But
we
yes,
we hold here.
Rastabai, we hold that topic here. And
Yeah,
Shikha wanted to ask something. Please, Shikha.
yeah.
Thank you so much, sir. It was a wonderful session, and especially the cases discussed by uh, uh, mm, both of you, sirs, regarding paraplegia and the person feeling that he had that sorry, I'm missing out the word.
Parkinson.
Parkinson. Sorry. So
Parkinson, yeah.
my take is that basically what we worked here is breaking the belief. So at our level, uh, when we are still learning and we are still starting to practice, is what is the route that we should take? Should we start with breathing awareness, then PMR, and then basically breaking the belief or replacing the belief with something else, and then proceeding gradually to hypnosis?
Hey, Shikha, the most important thing is what Prasanto sir told, proper diagnosis.
Yes, sir.
We need to begin, matlab in the beginning, proper diagnosis by relevant specialist like physician, neurophysician, or psychologist. You are a psychology branch person, na? So
Yes.
whatever psychological diagnostic system you are following, properly diagnosing the case. And as far as therapy is concerned, yes, for the beginner, I believe that you go systematically. So start with breathing awareness, relaxation, trance induction, teaching all those things, self-hypnosis. And simultaneously, in your discussion sessions, talking with the client, you try to find out what are the disempowering kind of thinking patterns in the client and jot them down. So at the right time, like after initial induction and self-hypnosis is taught, go for ego strengthening. And
Yes, sir.
if you are acquainted with ego purification type of thing, and that time you start discussing these um, beliefs also. Okay. And then depending upon the outcome, you can adopt some techniques like direct suggestions or using metaphor or going for other kind of hypnotherapeutic techniques. Hmm? To
Yes,
begin with and go this way systematically, it will give you better outcome, longer lasting outcome in most cases. If it is possible, if there is a hurry and you are not going to get any opportunity to meet the client again and all those kind of things, then you need to have some shortcut. But I believe in a long cut. Okay,
thank you so much, sir.
please.
Thank you so much.
Okay, so anybody else has got any comment? Yogesh Bhai was there. Yogesh Bhai, would you like to say something? Dr. Kandarana?
No, that's perfectly
Fine.
right. And basically, as you and Dr. Prasanto also said, the primary part is the correct diagnosis.
Yes. Hmm.
And once diagnosed rightly, the therapy will get modified accordingly.
Yes. So that should be the approach. Good. Thank you. So anybody else has got any comment or question?
Pranav, મારું microphone unmuted. ક્યાંથી થાય છે?
બરાબર છે ને તમે ઓકે હા હવે મ્યુટ થયું.
So I have one question. Is Parkinson's always an inherited disorder or?
Yeah, please, Avnish, you may answer.
Yeah, your question is Parkinson always inherited?
Yeah.
No, it is not always inherited because this part it's resulting due to either lack of the production of neurotransmitter in a particular circuit of nuclei in the part of the brain called as the basal ganglia. It's little technical, but this portion or this circuit may get damaged due to either trauma or any kind of cerebrovascular accidents, either ischemic trauma or the hemorrhagic trauma. So ultimately, it's a neurological circuit, and it may, in case where there is an inheritance, there is a like genetic modification because of which the till now properly performing neurons they start behaving in a altered way. So it can be in part of a genetic programming, but not always. It can also happen because of the other causes.
So genetic predisposition may be there, but not necessarily it is there in all cases.
Okay. I had a house help, her husband and the husband's sister both had Parkinson's. So, but again, now I'm wondering if,
Yeah. So not in all cases, but there is observation that there is many patients have predisposition, and history shows, but not necessarily it is a genetically transmitted disorder in all cases.
The
Okay.
symptom mimicry can start happening whenever there is already a person in the family who has this as a diagnosed problem. So I remember one that I handled one such patient at Samatvam only. For few sessions, I was handling that patient. And there the person was actually getting the symptoms because his father had it. This person was a middle age. So he started having it at little early age. But I have found in such cases they have some kind of either some event happening in life where they start feeling little helpless, and then they start getting this kind of symptoms.
Okay. So shall we close the meeting today? Meeting?
Yes, sir. Yes, sir. I'll stop with the recording.